Welcome in, everybody, to another episode of the Strength for Your Purpose podcast. Another week, another fantastic conversation coming your way. I hope you all were inspired by the conversation last week, and a real good. Yeah, if we've said it once on the podcast, we've said it maybe 1,000 times. That consistent, imperfect action can really snowball and give you a lot of momentum. And that conversation we had last week about Tate Sandrock's swim streak with his son over 150 days at this point in a row in the water. There's a lot of cool lessons there, more than just like waking up every day and trying to make it to the water. So if you didn't hear that conversation because you listened to the podcast the first time, I would highly encourage you to check it out. A lot of cool lessons there, including a guy that has gotten a 12-year-old to get up early before school to keep this swim streak alive. Take notes, parents. That's kind of a big deal. So but this week have another fantastic conversation coming your way. I'm really excited to introduce this guest to you. So without further ado, I am joined this week by Dr. Ben Hagopian, who is a board certified family physician specializing in integrative medicine, who earned his MD and his master's in public health from Case Western Reserve University in Cleveland, Ohio, and went on to train here in Maine at Maine Medical Center for 4 years. His desire and focus on health promotion and disease prevention, rather than simply treating symptoms of a disease, led him to do a fellowship in integrative medicine at Maine Medical Center and the Andrew Weil Center of Integrative Medicine at the University of Arizona. And just from that intro alone, you all know why I've got Dr. Ben here on the podcast. Doc, thank you so much for joining me here.
Thanks so much for having me. It's a real pleasure and an honor.
Awesome. Well, let's dive right in here a little bit. I want you to talk just a little bit because your bio there sort of alludes to the events, I guess, that sort of took place to lead you to where you're at now, where you have a direct primary care practice here in Maine. So talk to me a little bit about what got you to the point of needing to break away from the system you were sort of training in there when you were first out of medical school.
Sure. Yeah. So, I really, since I entered medical school, geez, I think about 15 years ago, I was definitely, mostly interested in primary care. I think that's what most people need. Most people need a high quality primary care preventive type approach to healthcare. So I kind of got sucked into that early. I decided to go that route with my career. I did the training at Maine Med, like you had alluded to. And then I felt like, even though the training I got was definitely high quality, there was something that I was missing. And I think it was too much focus on the downstream and the hospital taking care of people kind of when, end stage illnesses, hospital visits, all those things. While those are definitely important as an integral part of our healthcare system, I think what most people need and what I was seeing was really missing from the healthcare system is really a focus on high quality primary care. I
Yeah.
worked in a large health system for about 8 years, trying to provide those high quality primary care services and integrating the integrative medicine kind of more holistic approaches.
Mm.
And I just found that the current healthcare system doesn't really support that type of model, unfortunately.
Mm.
And I think there's many reasons for that. I think mainly, unfortunately, I think, you ask a question about why, and the answer is often money. And I think the reimbursement insurance based system, it could be better, and I'm certainly open to working in the future with fixing that system,
Mm.
but I just don't think we're there yet. And so I found the only way to really provide the type of service I felt was appropriate in quality and spending time with patients, which I think is the most valuable thing that any healthcare provider can do, especially in the primary care setting, whether
Mm.
it's primary care medicine, physical therapy, nutrition counseling,
Mm.
psychological counseling. All those things require time. They require relationship building. And those are not things you can kind of cut up into 10-minute widgets.
Mm.
And so I think the confluence of all those things made me realize, hey, there has to be a different way. I can either quit and leave the healthcare system altogether,
Mm.
or I can pivot to something new. And that's what I did.
Yeah. Well, yeah, very well said. I feel like we could have like 2 or 3 podcast episodes of a few of the points you made on right there. But yeah, no, I applaud you for that. It is hard working within the traditional medical system to do things in a way that provides just that higher value of care, because that higher value of care at the end of the day has to have that time factor that you just talked about, right? You have to be able to spend enough time with people to provide enough value. And no matter how great you are within that interaction with somebody, you can have an impact, but that impact could always be better if we just had that extra time, right?
Absolutely. I think the two things I've taken away from my practice are um, time with patients.
Mm.
And again, like those, the exercises I'm sure you share with patients, and the
Mm.
time and counseling I share with patients. Those take time. And the second thing is the longitudinality. So,
Mm.
I feel like the system I'd worked in before was, yes, you have a primary, but if something comes up in between your annual visit, you're seeing somebody else. And so
Mm.
I'm getting a lot of folks come to me saying, "Hey, I'm tired of seeing somebody new every time, and tired of telling the same old story and being told 5 different things. Like,
Yeah.
I need a quarterback." And so I
Mm.
think though that is incredibly valuable, especially as our healthcare system grows and becomes ever more complex.
Mm.
And we have a shortage of providers, and we have an overabundance of patients who need care. So I think those are the two key things: the longitudinality and the time with patients.
Yeah. No, no, 100%. And the, I say this all the time to people that I work with, and to people that I talk with about my model, people like yourself, or, personal trainers I work with, the chiropractors I work with, in the model where you're doing that direct access care, you're able to spend that one-on-one time with people and really just focus on what they need to get where they ultimately want to be. People just simply get better faster. And it's not that people weren't getting better before. I was stayed employed because I did help people get better, right? as
Right.
as did you. But that doesn't mean that level of care can't be that much better. And that's what this provides. And yeah, the for all of the benefits that insurance does offer people, the unfortunate part of it is it's kind of fallen a victim to its own loopholes and to, some of its own greediness, or however you want to classify it, and has turned things into, churn them in, churn them out, or as I like to call it, treat them and street them. you know you can get as many people in as possible, see as many people as possible, do what you have to do at a bare minimum to feel like that they got treated today, got some help today, and then rinse and repeat.
Right. I always think back to the quote, and I forget who said it first. I think it was a design engineer or some, from decades or even a couple hundred years ago, who said, every system is designed to get the result it gets. It's
Right.
perfect. It's perfectly designed to get the result it gets. So,
Right.
we have this broken system, and it works for the people running it. And I think the way out of this is to do a grassroots, movement like we're doing, and that is, um, I'm not opposed to working with, certain insurance companies or governmental entities,
Mm.
but I don't think we're there yet, and I think, I don't feel great about spending my career in a system I don't believe in, and so I'm trying to
Mm.
carve out something that I do believe in, where I can spend more time with patients, help them get better faster, know that I'm there for them when they need something. And I think my patients see incredible value in that, and I'm sure yours do as well. And I think the model is growing, whether it's, whether we want to call it direct or concierge or whatever we want to call it, is
Yeah.
just something different than what um, currently exists. I think is the key, where the healthcare practitioners kind of retake ownership of our profession.
Sure. Yeah. No, couldn't agree more. And last point I'll make on this before because I have definitely a few other questions I want to ask you about who you help, how you help them,
Absolutely.
what you're really passionate about. But the other point that I have to make, and you and I chatted about this the first time we talked, is that in all reality, this newer model, like you said, direct access, concierge, whatever you want to call it, even though the whole out of pocket thing sometimes scares people, it's usually cheaper than it's either cheaper or it's the same, right?
Correct.
The amount of money it actually costs them over the course of the year or the time frame that we're looking at is either the same or cheaper in that model. But that makes the value even better because, as we already talked about, people are getting such better service and such better care simply because we have the time, and that just skyrockets the value of the services.
100% agree. 100%.
Yeah. Awesome. So yeah, talk to me a little bit, Ben, about, I know you're in primary care, the integrative medicine background as well. Who are the people that you're really passionate about helping and seeing in your practice?
Yeah. Listen, I love, one of the reasons I want to get into family practice was to care for a broad swath of the population. I have all comers. I think we think about in healthcare, we think about, well, do you have insurance? Do you have good insurance? Do you have bad insurance? I really take all comers. I have,
Mm.
folks who are uninsured and don't make a lot of money. I have folks all the way up to, quite wealthy and everywhere in between. I love seeing folks who weren't able to access healthcare before they came to see me. And that
Mm.
makes me feel really good. The system kind of, either pushes them to the side or makes it unaffordable for them
Mm.
in terms of, so, and that's in terms of like the patient demographics. But I'll be honest, I see everybody. I love seeing babies. I've got a few newborn babies in my practice that really makes me happy to see them,
Oh, cool.
come in at day 2 or 3 of life.
Mm.
I had my first, I think my first baby who joined my practice a while ago. I just saw him this week for his 18-month well child visit, and it was delightful. And he used to come in all, bright-eyed and smiling at me, and now he is afraid of me, which is developmentally appropriate. But it's really great to see him grow up. That was really,
Yeah.
really, it's really heartwarming to be, part of that family and
Mm.
watch the family grow. I'd say most of my patients are, young to middle-aged adults. I have some older folks. I have a number of kids and babies and children.
Mm.
I really like the broad swath of the population I serve. And I love, like I also said, that I have uninsured, underinsured, and people who have good insurance and may have the resources, but are just pissed off. And I think that's a way not only for me to feel good about what I do, but also to kind of spread the word about this model that, like, hey, healthcare is affordable, it's
Mm.
available to everybody, it's high quality. I do get a lot of folks based on my integrated medicine background that really want to focus on lifestyle, that want to focus on maybe, just some folks seek me out because I'm more open-minded to things like
Mm.
acupuncture and, you know, um, PT and
Mm.
even things like energy medicine. I'm not an energy medicine practitioner, but I'm open-minded to it. I do a lot of work with patients on supplements, um, and a lot of lifestyle work. So
Mm.
for folks who come to me with, for example, depression, high blood pressure, diabetes, really anything, um, I tell all my patients, hey, I use my conventional medical training to help diagnose, and my holistic and conventional medical training to help treat. And so if
Mm.
we can work on your depression by getting you moving more, getting you eating better,
Yeah.
um, can we get you with a therapist rather than, reflexively writing a script and referring somebody to therapy that may take them 8 months to get into? It's not
Mm.
really doing them any good. It might, but I feel like there's a big therapeutic benefit to taking the time to listen to someone's story, hear where they're at, and provide the most appropriate, kind of array of options, and ask for their feedback and take that time. And that's where I think that time and relationship building really comes in.
Huge.
Yeah.
Huge. Yeah. I like how you put that reflexively, writing the script for the pharmacy, as well as writing a script for a referral. I find that especially in my field, it can be very easy to get complacent in the things that you feel comfortable doing when you see certain things, right? So you're always trying to, well, in medicine in general, you're always trying to learn and grow and be a lifelong learner and fight the complacency a little bit
Absolutely.
as we learn more about the humans that we're interacting with and we're helping. But it's even harder to fight that complacency in again, that sort of treat them and street them model. So any way that we can kind of break that cycle and make it easier on us for practitioners to get better at our job, while simultaneously allowing that time and that relationship building to foster a better model as well. That's just a win-win for us because it makes our job that much easier when we have the time to do that.
I completely agree. And I love, one of the things I do now that I was not able to do before was say, hey, Joe, you've got depression, let's just say, and we're going to, let's say we just started medication, we're afraid of counseling, you're going to work on your nutrition, you're going to work on exercise, try to do most of these things if you can. We have a good plan in place. I can send them a text message in a couple of weeks and say, hey, how are you doing? Any hiccups? Anything you need from me? And most times they say no, but I think just the fact that they know that I'm there for them and that I care, even just a little bit, I think goes a long, long way. And that access to know that, they're, there's this a feeling of safety and security in that relationship. So
100%. I mean, and where else are you going to find your primary care doctor shooting you a message like, hey, how's that thing going? I until I learned more about this model, that's absolutely unheard of. I mean, the organizations out there have the online portals and charts and things like that, but all of those types of communications are really originated from the patient or the consumer,
right.
not from the provider. So when the provider themselves has the ability to initiate that communication and that check-in to help with the follow-through on that plan that you set up in your visit, that's that's unheard of outside of this model.
And it really kind of gets back to the ethos of healer, and I think that would apply for PT, counseling, a lot of these, these foundational primary care. I'm not talking about primary care in the sense of primary care medicine, but like these foundational primary care modalities of PT and therapy and in medicine and these things. But just that I think we get, we're innately healers, and things like what we just described about reaching out to patients rather than letting them reach out to us, I think kind of speaks to the purpose of our work, like what is our purpose? And I think we are all healers. We want to be healers. This may be a little cynical, but I do think the system, the conventional, the treat them and treat them model kind of beats that empathy and healing nature out of us.
Mm-hmm.
And this is a way to reclaim it. And I don't want to come across as overly proselytizing here, but I think there's an enormous value in the longitudinal nature of the relationship and of having a purpose as a healer. So
yeah, no, 100%. You nailed it. You nailed it. I don't. I have no more to say about that. That was
all right. Cool. We're done.
So yeah. No. That's the end of the episode. No, fantastic. So tell people a little bit more about your actual practice, Maine Family Care. I don't think we've said that yet.
Yeah.
I realize
Maine Integrative Family Care. Yep. So it's a direct primary care practice. So we haven't really talked about what that means exactly. So direct primary care. So I'll kind of let me circle back. I'll talk a little bit more systems, nuts and bolts here real quick. So most folks go to the doctor, they give an insurance card. The office runs the card. The patient gets seen, treated and treated.
Yeah.
And then the patient goes home and says, God, I hope insurance covers that. Usually what happens is they get a bill, a couple do a few weeks later in the, hundreds of dollars range. The second option, which is older than direct primary care, but not too old, is concierge medicine, where kind of same model. You show up, you give your insurance card, they bill your insurance, and you also have to pay a monthly or annual fee to belong to the practice. So that one, I think there's definitely value in that. I think you have to be pretty wealthy to belong to a practice like that. And so what direct primary care does is kind of a hybrid, where it's basically we don't do any insurance and we do just the monthly fee. And so the average monthly fee across the country is somewhere around $80 a month for essentially unlimited primary care. I limit, and most of us limit our patients to about 10 visits a year, which is more than enough for folks,
Yeah.
for almost everybody. And so patients pay the monthly fee to belong to my practice. They can see me when they need to see me. They can text me, email me, call me, telehealth. I usually tell them anything I can do for you, whether it's a visit,
Mm.
a procedure, if I have to do a joint injection or a skin biopsy or stitches or something like that, that's included. And then everything else is, quote unquote, extra. But it's just me and my assistant, and so the two of us are there to respond to your needs. You're not going through multiple layers of bureaucracy to get your questions answered. You can text, you can email, you can call, and you're going to get one of two people 100% of the time, which is really nice. And so it's really great. I brought Nicole on a couple months ago. She's been awesome. Patients like working with her.
Yeah.
I really enjoy working with her. And so again, it's that relationship building over these months. We just moved our location. We're in South Portland now, kind of near Cash Corner, off Broadway area. It's really lovely. What else can I share about the practice? So typically folks will join when they're looking for something new and fed up with the old system or can't afford healthcare, or just referred by a family member or friend. They come in for their intake. My intakes are usually 75 to 90 minutes to get to know them, focus on what's really important to them. We make a plan. We bring them back every so often depending on what their needs are. And like I said earlier, I really do use the conventional medical training to help diagnose patient issues, and the holistic and conventional and patient wishes to help guide the treatment plan. So I'll often say, hey, these are the things we can do. What do you think is going to work best for you? And an example of that would be something like, let's see, someone's having, I hear one of the complaints I hear a lot is gut issues. I'm bloated, I'm having loose stools, or I'm constipated. And I don't want to get too graphic on your podcast, but that's a common thing I hear. Sure. So we kind of go through what could be causing this, and we'll come up with maybe some supplements, maybe some testing we'll do. Maybe we do an elimination diet where we cut out certain foods out of their diet and test that, test those foods one at a time. And I hate giving people 6 different things to choose from and say, oh, go do all these 6 things. But then I'll say, hey, these are the things. What do you think is going to be most high yield for you? And also, what are these things are you actually going to do? What's going to fit in your lifestyle? I can't sit here and say to, with a straight face to a young mom of 3 kids who's busy all the time, oh yeah, spend 3 hours a day cooking these like vegan gluten-free meals. It's not possible. So I think taking that time to know their life circumstances and figure out what works for them and their families and lives is really key. And then, I do physical exams. I do acute visits. We do regular follow-ups depending on what the patient needs. And that's it. I'm available for questions. If something pops up, COVID is a big one. Obviously, these last couple of years, people say, I got COVID. What should I do? And I usually just say, stay home and I'll send you some information. Right. Maybe we'll write you for some medication, but one of those things, you don't need to come in the office for that. Why am I going to, why are you going to come in? You don't feel well. Why am I going to expose myself? And why am I going to waste your time? Let me take care of you in the way that works for you, which is maybe from the comfort of your home, That's kind of how the practice works. The other thing I'll say is, we also provide heavily discounted lab and x-ray services. So we get those services at wholesale prices and pass those along to patients, which is a big benefit. I will say I have a handful of patients in my practice who actually save money coming to me because their lab fees were so exorbitantly high before. And, 1 or 2 visits into the year, they've, saved money. So that's another thing I like to brag about is, hey, these cholesterol tests that you're used to paying hundreds of dollars for are actually less than $10 when you dig down to it. So I really love, if your listeners haven't gotten this yet, I love primary care. I love what I do. I also love bucking the system and finding ways to beat the system. Whether that's lab fees or prescription drugs or, holistic healing or just a whole array of modalities. That's kind of it's kind of my jam.
Yeah, no, that's fantastic. Awesome. Yeah, no, that's great information for everybody. I highly encourage everyone to check that out. And I've got a couple more questions for you, Ben. But before I ask that, what's your website? Where can people find you on social media? All that good stuff. How do people find you to learn a little bit more information about your practice if they're interested in learning more and reaching out to you to finding out how you might be able to help them?
Great. Yeah, sure. Thank you. Yeah, they can find me at mainefamilycare.com, MAINE, familycare.com. They can also email me directly at ben@mainefamilycare.com.
Wonderful. Awesome.
I'm trying to avoid social media. I post maybe twice a year on Facebook, and I think my wife posts once a year on Instagram. That's about it.
Gotcha. Great. Well, I encourage everyone to check that out, and we'll make sure that we have all of that information in the show notes so that people that want information can go right there and find that out and reach out to Ben here and learn more about how he can help you. So I got two more questions here for you. Number one is, what is your definition of strength?
Definition of strength. Oh, throw me for a curve here. Let's see. You can edit this, right?
Yeah, there's no right or wrong answers. There's no right or wrong answer.
Okay.
It's not a trick question.
Yeah. What is your definition of strength? Okay. I mean, I think you could take this a couple different ways. I mean, I think you could take it from the physical fortitude and say, well, how strong is this person physically? But I see a lot. I think the older I get, the more I see the value, the superior value of mental fortitude. So I would say, yes, physical fortitude, but more importantly, mental fortitude.
Yeah, fantastic. Well, and they both play off each other so much.
Absolutely.
So yeah, no, that's fantastic. And then the final question I have for you is, what is your true purpose in life?
It's a great question. I'm still figuring that out. I think maybe a lot of us are.
Yeah.
I have always wanted to work in healthcare from a professional standpoint, and I've always wanted to change the system. And so I think this is the beginning of my journey to help with that. I've also welcomed two beautiful children into the world. And so, the non-professional side of it is to raise a couple of, be a great father, a great husband, and welcome a couple of loving, empathic, caring souls into the world.
Fantastic. That's great. Well, I applaud you for doing both of those things, and by actually helping people build their mental fortitude by having more confidence in someone in the healthcare system or out of the healthcare system, but in the healthcare field, who is going to help them build their physical and mental fortitude and be stronger so that they can fulfill their true purpose in life. So thank you for that, Ben.
Thank you for asking those questions. You caught me off guard a little bit, but
yeah.
I hope my answers were adequate.
They were fantastic. It was awesome. And thank you so much again, Dr. Ben Hagopian of Maine Integrative Family Care. Thank you so much for taking the time, Ben, to come on here, share your story, share how you're helping people. And really excited to see where things go for you, your practice, and all the people that are fortunate enough to be in your care. So thank you so much for your time.
And Phil, thanks so much for having me on. Thanks for the great work you're doing at WorkFit Maine, and for bucking the system yourself, and for providing a really valuable service for your patients and our community.
Yeah, well, thank you very much for that, and my absolute pleasure. I find a great sense of passion and purpose doing that myself. So we're very like-minded in that way. But yes, thank you very much. And for all of you listening, definitely hit up the show notes, check out the website there, reach out to Dr. Ben here if you have specific questions. And again, thank you so much, Ben, for your time. Everyone out there, thank you so much for listening. And we'll see you back here next time on another episode of the Strength for Your Purpose podcast.